Cornelius Wilson from the Black Men's CAC, Anuja Deo from the Young Survivors, and Elaine Rashke from the Rural CAC. And so with that, I'd like to get it started. We're going to turn it over to our speakers. So Kathy Smolinski is, I just think Kathy's background is so cool. She was an oncology social worker for many years and then went back and got a law degree and now has combined those two beautiful skill sets into work as a clinical professor and director of the Legal Advocacy for People with Cancer Clinic at the Wayne State University Law School. And I also want to introduce Min Jin Wong. He's an adjunct professor and staff attorney at the Legal Advocacy for People with Cancer Clinic at the Wayne State University Law School, and they're both going to talk about employee benefits for people with cancer. So Kathy and Min, please take it away and let us know if you need any help as we go through the presentation. Oh, one thing, you all should have had two quick things. You all should have gotten a notice that this meeting is being recorded, just so you know. And then also, we would love to have questions at the end of the presentations, but we're going to take them at the end of the presentation. So as you think of things, please feel free to put them in the chat and we will have some time for questions at the end. Thanks.
Okay. Thank you so much, Teresa. I really appreciate that. Very generous introduction. I'm very excited. I've now been working with Teresa for a few years, at least, sort of combining her passion with my work. And LAPC has been around for about 12 years. So we help individuals being treated at Carmanos Cancer Center who can't otherwise afford an attorney be able to get their legal needs met. And clearly issues of cost come up, especially around leaving work, benefits at work, et cetera. So when Teresa asked us to talk about this, it seemed to be just definitely a natural fit. So we will definitely take questions at the end. So one of the things that I'd like you to do is feel free to put questions in the chat as we go through. And then I think Ali has been really good in previous renditions of this to then field all those questions at the end for us so we can try to get through as many as possible. Terrific. All right. Sorry, I'm trying to work around a little kitty cat here who just can't seem to be away from me for 1 second. All right, let's try this. Okay, great. So I just want to put on a disclaimer here. So Min and I are lawyers. However, we're not your lawyer. We're just here to provide information about benefits and other rights that employees have. And if at any point in time you think that, boy, I think I would like to talk to a lawyer more about that, you're welcome to reach out to us and we can connect you with some different ways to get in touch with a lawyer in the state of Michigan. Okay. So when we talk about cost and thinking about financial costs of cancer, obviously many folks, their primary source of money is income from their work or wages. And so if that ever becomes jeopardized or called into question, that can make it really difficult for them to either continue treatment or make a decision. Do I do treatment and work? Do I delay treatment? How do I do this? Do I just take a break from work? If I take a break from work, do I get paid? Do my benefits continue? There's just a lot of questions that come along with those choices. And so today we wanted to go over several of the benefits that are available to many employees, and just so you have a basic understanding of what they are and how they work, so you can appreciate that if you find yourself in a situation where you're like, I think I want to tap into that benefit, or I wonder if I have that benefit, you'll have some language around it and some understanding of how they work. Okay. So one of the really important things I like to stress whenever I'm talking to individuals who have a diagnosis of cancer is that you are never, ever compelled to ever have to disclose your cancer diagnosis to your employer, ever. Okay. Now, some of the benefits we're going to talk about tonight do require you to disclose information, medical information for, let's say, to get an accommodation at work. So there has to be some medical proof of your need for an accommodation. And Min's going to talk about that later on tonight. But the kinds of information that you have to produce does not have to say that I have this cancer, so I need this accommodation. It can say, I have the need to, I have some mobility issues. I need to be at a desk that's closer to an exit, a bathroom, et cetera. But it doesn't have to say why you have those mobility issues. Okay, so I just think that's really, really important. That's not to say that you shouldn't tell people at work that you have cancer. That's very much extremely an individual choice. But I just wanted you to know from a legal perspective, you are never compelled under any law to disclose that you actually have cancer. I just want to let you know that. So one of the things that, and I apologize, on the very first slide that we had listed a couple gentlemen, those were two of our students, two of our graduating 3Ls in LAPC that helped put this presentation together. And I had them think about what is it like for all the clients that they've been working with over the past several months about how to put this information together in a way that seems digestible. And so they've put a lot of this together for, and I'm very grateful to them. One of the things that when you think about trying to manage work is to think about how to get through your day. So one of the things you're going to see on here, it says take breaks, create lists, set alarms, use the resources around you. So one of the things to realize is that it doesn't have to be all or nothing. It doesn't have to be I'm either working or I'm not working. You can work with adjustments. And Min's going to talk a lot about that a little bit later on. And one of the things that when you have to make that decision, information is always powerful. So to know what benefits you have can help you better make a decision about what I should do with regards to going part-time, staying at work, retiring, etc. So one of the main benefits that employers provide is health insurance. Okay, and we did a whole informational session on health insurance last month or the month before, and so so this is just going to briefly talk about health insurance. But I think it's really important to know that larger employers, because of the Affordable Care Act that passed in 2014, now have to provide health insurance for their employees. Prior to that, they did not. Smaller employers do not have to. If they don't, if larger employers don't, then they can come under a penalty under the Affordable Care Act. That being said, most employers will provide health insurance because it's such an incentive to have people come work for them and stay employed with them. So it's very much probably one of the benefits that's a little bit more universal than some of the other ones we're going to talk about tonight. But I just wanted to let you know that had I given this talk 6 years ago, 7, 8, whatever years ago, 2013, 10 years ago now, that I could have said, oh, your employer does not have to provide health insurance, but now larger employers do have to. So I think it's really important to think about when you're at work and you're either starting a job, what health insurance coverage to choose, or if you're already currently working, making sure that you understand your coverage, because most employers will provide really traditional health insurance, which is you can pretty much go to anyone you want in the network. Like say it's Blue Cross Blue Shield. It's usually the most expensive, and there's very little limits on it. You can pretty much go to anybody, any kind of provider. And that's usually, I'll just use Blue Cross Blue Shield as an example. That's called like traditional coverage. Those plans are still out there, but the majority of plans fall under HMO or PPOs, which are health maintenance or preferred provider. And basically, they both are managed care options, okay? And so, and it basically, managed care is just exactly like it sounds. The care is overseen, is managed to, in an ideal world, provide the best coverage and service you need at the lowest cost, obviously to the insurance company, but then also to you based on copays, et cetera. So when you think about HMOs and PPOs, people say, well, Kathy, what's the biggest difference? And in HMO, everything, for the most part, with the exception of some preventative tests, et cetera, everything comes through your primary care physician. So your primary care physician is the sort of the point of entry for your health care. And if you're not feeling well, you go to your primary care physician. If you think you broke a bone, you go to your primary care physician. And then from there, they will then make a referral to a specialist. Okay. PPO is a little bit different. With a preferred provider, I can go directly to that specialist, but I have to stay within network, right? The preferred providers. If I don't stay within network, I can still have some coverage, but it might be more costly for me to go out of network. Okay. So for individuals who have usually little or no medical needs, a lot of times they'll use an HMO because they don't mind going through their primary care physician. There's not a lot going on. Preferred provider, you have more direct access to specialists. So sometimes individuals who have a diagnosis of cancer and they're, able to choose at work which one they want, because if their provider, if their employer allows different choices, might pick a preferred provider, because a lot of times when you're dealing with cancer, you don't want to necessarily have to go through your primary care physician. You want to get to that specialist as soon as possible. So it really is an individual choice, but that's the primary difference between the two. Okay. So the next benefit that a lot of people consider when they have a diagnosis of cancer and are going through treatment is the Family and Medical Leave Act. I need to take off time. Is it going to be covered? Does that mean I'm going to lose money, etc.? So one of the things that's really important to understand is the FMLA is a federal law. Okay, Family and Medical Leave Act, it's federal law. So because of that, universal around the country, and it does not apply to all employers. Again, bigger employers. But the biggest thing I think people misunderstand about FMLA is they think it's job protection that comes with income. And the truth of the matter is it can, but under the law, that's not what it's designed for. It's designed to protect your job. So you have 12 weeks of protection. So you have the ability to be off of work for up to 12 for up to 12 weeks at a time, but you have to be a certain type of employee. And what I mean by that is you have to have worked for your employer for a particular amount of time. You also have to have worked there for a particular amount of hours. In this case, 1,250 hours. Okay. And the reason is that you can't start a job immediately and then be eligible for FMLA. That's not quite how it works. It's one of those benefits that comes after time. Okay. You have to work at an employer who employs a lot of people. Even if the branch, let's say, of the bank that you're at doesn't employ a lot of people, but all the branches combined within 75 miles have at least 50 employers, then you're eligible for FMLA. Okay. And it applies to all public agencies, etc. Okay. Now, what people, the 12 weeks that you're allowed is within 12 months. And so what a lot of individuals don't know is, when do those 12 months start? That is absolutely under the law up to the employer. So an employer can do it rolling 12 months. So this is April. If I needed to take time off right now, the employer can say, okay, Kathy, your 12 months starts now and goes to March of 2024. And within that period of time, I'm allowed 12 weeks off. Some employers say, oh, we do a January to December. You can take 12 weeks within that period of time, and then it refills next January. So if that's what your employer follows, if that's how their policy is, it is true that you could get multiple weeks off, because if you took your FMLA at the end of the year, and then again took it at the beginning of the year in January, if they were on a calendar year, you could actually get more than 12 weeks off, okay? But most employers do it on a rolling basis, that from the time you start to the time 12 months later, you're allowed those 12 weeks off. Now, what's important is that they don't have to be consecutive. So if you have chemo every 2 weeks, and the day that you have chemo and 2 days afterwards, you're just wiped out, you can take 3 days off every 2 weeks, and that's completely allowed. Intermittent FMLA is allowed. You can also take it as one big chunk. Okay, so I think it's really important to understand that you can take it as one big chunk, but you don't have to. So if a work week is traditionally 5 days, and 12 weeks of 5 would be about 60 days. So think about having 60 days to sort of play with, if you will, in a year. So I definitely know clients of ours that will take off periods of time around their chemo and not a big block at one time. The other thing that's important to understand is FMLA is also for caregivers. So if you're the caregiver of somebody going through treatment, you can also be able to access FMLA if it is provided at your job to be able to be with your loved one who is going through treatment. Okay. Now, can you get paid? The answer is yes, but that's if you have time banked. So for example, if you have vacation time, if you have sick time, if you have paid time off, which we're going to talk about in a minute, if you have that and you want to go out on FMLA, an employer can require you to take both at the same time. So an employer can say, Kathy, you want to go out tomorrow for 6 weeks on FMLA? We're going to approve that, but we're also going to ask you to simultaneously take all your vacation days along with that. Why can they do that? Under federal law, they're allowed that. One of the reasons is if you think about it, an employer doesn't want somebody out for months at a time. So if I could back everything up, if I could take 3 months under FMLA, then 3 months of my vacation, and then another month of my sick time, I could literally be out as an employee for several months at a time. So the employer is allowed to say you have to take both simultaneously. One of the things that people also forget about is that when they're getting paid, okay, so let's say I have no sick time, I can still go out on an unpaid leave for 12 weeks, and the employer still has to provide my benefits to me. But if I'm making the premium payments, I have to continue to still make those. So that's very important to consider how you're going to do that. So I'm used to having my paycheck be reduced with my premium. So pre-tax premiums get paid directly to Blue Cross Blue Shield. But if I'm not taking a paycheck because I have no time off to dip into, so I'm taking unpaid leave, then I may have to write a check or make a direct deposit from my bank to Blue Cross Blue Shield every month to continue to pay that premium. So the employer has to provide me the coverage, but I still have to pay for it. And so people individuals sometimes forget to make sure they understand the mechanism with which they're going to continue to pay for their benefits, because there won't be automatic withdrawal from their paycheck because they're not getting a paycheck if they don't have any paid time off saved up. Okay. So people will say, well, how soon do I have to tell my employer that I need the time off? And under the law, it says as soon as you know. Most reasonable as possible. So if you found out today that you need tomorrow off, that's when you tell your employer. Okay. The employer can't say, oh, that's such short notice. If that's really when you found out, that's absolutely fine. It's just that as soon as you know you need to have time off, then you're to tell your employer. So the next thing is a leave or a sick leave or an illness bank. And the reason I called it as a bank is because some employers, especially larger ones, will say that people can contribute to banks and also take from banks. So I know clients who will say, oh, at my work, people are allowed to donate to my sick bank. I'm allowed to then have more days off because Min gave me a week of his sick time. Now, there's probably limits about how much can be donated, et cetera. But the point is that if your sick bank or your sick days are relatively few, that doesn't mean that that's all you have. You'd want to check with your employer to see, do they allow for other people to fill your sick bank with some of their own sick days? So it's really important to look into that, because that really is something that employers like to do. Why? It's a nice incentive. It makes them look better than other companies, and especially if they want their employees to be happy. Okay. It's just really important that you're familiar with your own company's policy. Okay. Michigan actually has its own Paid Medical Leave Act, which is very specific. It's a Michigan law, and it basically went into effect about 4 years ago. And it says that employers must allow for paid time off. The tricky part about it is most employers already allow for paid time off. Most people have PTO or have time off. So it's really, this isn't in addition to that. This is just saying that an employer must allow for at least X number of days in a year that you can take off if you're sick. And so if they already provide that through your paid time off or through your sick time, they're not required to provide more. But if an employer doesn't have any PTO or sick time, then, and you do get sick, then under this act, then they do have to allow for you to take some time off, okay? And you accrue it. So you can see here on the slide, you actually accrue it. So it's something that, you know, you get as much time off as you accrued by working there. So when we think about vacation days, which with this lovely weather makes us all think about vacation days a little bit more, there's no federal requirement for vacation days. Okay, so when you think about benefits and you think about, you know, does my employer have to provide vacation days? The answer is no, but most do. Why? Because we want people to rest, come back. So again, you want to know how many vacation days that you have. You might want to know what the vacation policy is. And if you're thinking of leaving your job, let's say you weren't really enjoying your job anyways, treatment's coming up, you want to take a break from the job, you're going to actually leave that job, or let's say you have a new job you're coming to, etc. You also want to see if there's any payout with PTO or vacation days. Okay, so many employers will pay out at half the amount. So let's say I have 30 PTO days, I will get paid for 15 of those if I leave. I'm not considered still employed there, I get to take that as cash. So again, depending on where you are with whether or not you're going to stay or not, it's just important to understand, do I have vacation days? How can I use them? And am I still accruing vacation days when I go out on vacations? Because some employers have different policies around that. All right. I thought it was interesting. I just wanted to put that up there about Europe because I thought that was fascinating. For anybody who's ever traveled to Europe, Europeans really like to enjoy their holidays and their time off work, and it's actually built into a lot of their countries' systems. We don't have that. Again, there's no national law for time off. Life insurance is something that I think is important to talk about because a lot of people may not be aware, especially when you first got hired, you might have been so excited, you kind of went over your benefits really quickly and didn't realize that your employer provided life insurance. Or you might forgot that your employer provided it. It's always great to just double check and make sure that whoever you put down as the beneficiary is still the person you want to benefit from it. Sometimes, especially if we worked at a place for a long period of time, the important people in our life may have come and gone. And so maybe the person that I put down on my beneficiary at Wayne 12 years ago is not the same person I'd want to put down today. So it's really important to take a moment and check. You can change your beneficiaries at any time, but those are the people that would then, upon your death, receive those funds. The other thing to know about life insurance is that a lot of employers will provide it at no cost for like 1 times your salary. So if I make $35,000 a year, I have $35,000 of life insurance at no cost to me. But then I can purchase it for a small amount and double it. So I could purchase 35 more through my employer and have $70,000, let's say, of coverage. Okay. So a lot of times when employers do it, is again, it's an incentive to provide it at no cost at your salary rate, but you can sometimes purchase more. So it's important to know that. I think the other thing about life insurance that surprises a lot of people is we've had clients who unfortunately could not go back to work. They left work because they were disabled and were never able to go back to work because of their disability, and their disability was from their cancer treatment. So I've had a couple clients say, you know, I had a life insurance policy through work, but I haven't paid the premiums in 8 months because I left 8 months ago. And the premiums that I was paying through my employer, you know, obviously I haven't got a paycheck in 8 months. So with their permission and authorization, my students would talk to the HR department. Turns out that life insurance policy was considered paid in full the day they left because of them being disabled, okay? And they did not return. So no more premiums were required on that policy, and that policy is now considered paid in full. So when that client dies, that her family or beneficiary, whoever she placed down, will get the cash value of that life insurance policy. So it's something always worth looking into if you left a job because of disability, to see if where the life insurance policy is. Not all life insurances pay out that way, but some do. And I think it's just really important to remember. Working with human resources, a lot of individuals will, remind me that, well, human resources is really there for the company, not for its employees. And the truth of the matter is yes, the human resources department is there to protect the company, but they're also there to provide you information about your benefits. So at any one point in time, you can always ask for a updated employee manual. You can ask for an updated copy of the life insurance policy, an updated copy of short-term disability policy. That is what they're there for. And they're also there to explain your benefits. Sometimes that's where an advocate can come in really handy. You might be exhausted from your treatment. You're tired of trying to explain yourself to your employers. So a lot of times my students will, with permission from our clients, actually be the ones to talk directly with the HR department to find out what are the benefits that somebody's paid into, and how do we get the claim forms? How do we start completing the claim forms so that benefit can begin? Okay. I always tell people, whenever you talk to somebody anywhere, but especially in an HR department, always make sure you know who you're talking to and locate and record the date and time as well. Because why? Sometimes people give you bad information and you want to be able to say, well, that's not right. Teresa told me 3 days ago that this was what my benefit was. And the reason is you want to try to get the most accurate information. And if you have multiple people that you're talking with, sometimes that can be good because somebody that you talked to didn't know and you actually had a better benefit, or it could be bad. So you just want to always keep track and keep really good notes about information that you get. I will tell our clients a lot, it's great to follow up with an email. Oh, it was wonderful to talk to you, Teresa. As I understand it, I have 72 sick days banked right now that I can take at any one point in time. If this is incorrect, please reply in the next 24 hours. Otherwise, I will take it that I understood that from our conversation. And then, or please reply with a confirmation that I got it correct. It's a nice way to start a paper trail, and it's a great way to make sure that you heard the same thing that your employer said. And now I'm going to switch it over to Min, and he's going to talk about rights and benefits about disability. Stop my share here.
Okay, thank you, Kathy.
Real quick and remind people to, if you have questions, start thinking of them and putting them in the chat. So thanks, Kathy. Sorry, Min.
That's okay. Thank you, Kathy. Give me one moment here while I get my slides going here. Great. Hope everyone can see that. So for the remainder of today's presentation, I'll be talking with you about some of the disability-related rights and benefits that may be available to you through your work. These rights and benefits that are important things to keep in mind as you sort of navigate your work during your cancer journey. So the first thing that we're going to talk about here is we're going to talk first about disability-related rights and protections that exist in the workplace, okay? There are a number of laws that exist at the federal, state, and local levels that actually protects employers or prohibits employers from discriminating against people with disabilities. At the federal level, what we're looking at here, or what people most commonly hear about, is the Americans with Disabilities Act, or short, it's called the ADA. All right. But in addition to that, we also have some protections at the state level. And there you're looking at the General Civil Rights Law, which is the Elliott-Larsen Civil Rights Act. But in Michigan, we also have a Civil Rights Act that's specific for persons with disabilities called the Persons with Disabilities Civil Rights Act. Okay. Now, if you go even lower to the city or township level, using the city of Detroit as an example, there is a section in the city code that addresses disability discrimination in the workplace, okay? I know that's a lot of different laws to talk about. So the ones that we're gonna focus on most during today's presentation is the Americans with Disabilities Act, okay? And the reason for that is because the ADA is a federal law. So it applies to everyone across the country, not just to Michiganders. And it tends to be the one that is most often litigated. So there's a better understanding of how that law works, okay? All right, now aside from disability rights and protections in the workplace, of course, we're gonna next talk about cash benefits, okay? We're going to talk about specifically the two main ones that comes up in the employment context, which most people know as short-term and long-term disability. And then very briefly, we're also going to talk about some cash benefits that you may be eligible for through the government in case short-term or long-term disability either is not available or runs out, okay? Just a little bit of a heads up, we will have a presentation next month on May 9th, where we'll actually talk more about disability-based cash benefits in greater detail. So if you have a minute, jot that date down and that time, and then hopefully we'll get to see you here on Zoom, and we'll give you more information about that. All right, so with that, we're going to turn over and we're actually going to talk a little bit about the Americans with Disabilities Act, okay? All right, so first of all, let's actually talk about what it is, okay? So what is the ADA and what does it say about disability in the workplace? The ADA, as I mentioned before, is a federal law that was passed by Congress in DC, so it applies to the entire country, okay? It also applies to all phases of employment. Now, that means that it doesn't only apply to existing employees. It also applies with people who apply for a job as well, okay? The law's primary goal is to help persons with disabilities secure and maintain the same opportunities as a person without disabilities, okay? To meet this goal, the ADA generally requires employers to give reasonable accommodations to persons with disabilities who either works for the employer already or is applying for a job with the employer, okay? Now, one thing I'll quickly go back real quickly is that even though there is that protection, the employer will always have the right to hire or promote who the employer believes to be the most qualified person for the position, okay? Just because the ADA protection exists doesn't mean that it automatically guarantees a person who has a disability and applies for a job that that person will necessarily get it, okay? The employer still has a right to make sure that they're hiring the best person they believe is for the job, okay? All right, so next question that you may be wondering is, does this law apply to my employer if you're currently working? Now, the ADA applies to all public employers, like the federal government, for example. As for private employers, like General Motors, Ford, Amazon, Walmart, just to name a few, it only applies to private employers with 15 or more employees, and that's including part-time employees, okay? So let's look at an example here. Sarah works as a waitress at a local mom and pop diner in her hometown that has a total of only 5 employees. Does the ADA apply to Sarah's employer? The answer is probably not, all right? However, remember that we do have other disability-related civil rights laws at the state and also at the local level. In this situation, Michigan's civil rights law that protects individuals with disabilities may protect Sarah in that situation, because unlike the ADA, the law that we have here in Michigan applies to all employers so long as they have 1 or more employee, okay? All right, so the next question that you may be wondering is, does it apply to all employees? Under the ADA, a person can only ask for a reasonable accommodation if they are what's called a qualified individual and that person has a disability. Let's look at each of these two requirements, okay? First, a qualified individual just means that the person asking for the accommodation can perform the job duties with or without a reasonable accommodation, okay? So let's say that the law school's hiring a new lawyer and someone with a disability who applies for it doesn't have a law degree, right? And it's a requirement for the job. Well, in that situation, the person wouldn't be considered a qualified individual, okay? Now, the second requirement here is that the person has a disability, which the ADA says means that the person has one or more physical or mental impairment that substantially limits a major life activity. Now, the limitation can be caused by either the medical condition they have, or it can be a side effects of the treatment that they're getting because of their medical condition, okay? The other thing to also note is that the disability doesn't have to be permanent, like if you lose an arm or a leg in a car accident or something like that. It can be temporary, with cancer being a perfect example, right? Because our hope is that with treatment, someone with cancer will recover and their cancer will be in remission, okay? However, the medical condition cannot be what they call transitory, okay? And what that usually means is that it can't be a medical condition that will only last for less than 6 months, okay? Or has only a minor impact on your daily life. So as an example, if I catch a nasty case of the flu and I'm laid up for a couple of weeks, that won't be considered a disability under the ADA, okay? Now, one thing you might have noticed in that definition of disability is this term called major life activity, okay? What does that really mean and what actually counts as major, okay? Here are some examples just to give you a sense. By federal law, major life activity would include walking, talking, breathing, caring for oneself, working, tasks of daily living, sleeping, concentrating, thinking, communicating, and other major bodily functions, including normal self-growth, okay? Which is interesting. I would just note here that the law was recently changed about 12 years ago at this point in 2011 to broaden what exactly counts as a major life activity with the goal of making sure that a lot more of the health conditions that people are having are covered under this law and is being protected, okay? So in this example that I got here, June is undergoing chemo treatment. She experiences chemo brain or chemo fog, as people like to refer to it. In this situation, the cancer diagnosis itself may not have been what's limiting June's ability to concentrate, which is a major life activity, but the side effects of her chemo does limit her concentration and thinking. Okay, so in that situation, the symptoms that she's having of the chemo brain and the chemo fog would be considered something that will qualify her for as a disability under the ADA. Okay. All right, so what exactly is the protection that the ADA actually covers, okay? First, it prohibits employers from discriminating against a qualified individual with disabilities because they have this disability, all right? The second piece of it is it requires employers to provide reasonable accommodations to employees and job applicants who are qualified persons with disability. Okay, we're going to focus a lot more on reasonable accommodations since that comes up quite often, all right, and tends to come up more. Okay, so what is a reasonable accommodation? A reasonable accommodation is any change in the work environment or the way things are customarily done that enables a qualified person with a disability to enjoy equal service opportunities, okay? Just to give you a sense of what that may look like, David here works as a cashier at a local supermarket that doesn't normally allow cashiers to have drinks at the register, okay? But David, because of his cancer treatment, particularly his chemo, makes him very thirsty. So as an accommodation, he can ask his employer, hey, will it be all right if I can have a water bottle by my register while I'm working the checkout line? Okay, so that can be an example of a reasonable accommodation. Okay, now the thing you may be wondering is, well, if that's a reasonable accommodation, what isn't a reasonable accommodation? Okay, and that comes up in this language that's called undue hardship. Okay, under the ADA, employers do not have to agree to every reasonable accommodation request if agreeing to the request would cause them what's called undue hardship. Okay, now much like reasonable accommodation, it's not necessarily a fine line as to what is considered undue hardship and what's not. It has to be decided on a case-by-case basis. There is no bright line rule on that, okay? But just to give you a sense of some of the things that will get considered if this question comes up, is they will look at the cost of the accommodation to the employer's financial resources, and also the impact of the accommodation on the employer and how they operate. Okay, so there is a little bit of balancing here that a court or whoever is deciding this issue will try to do to make sure that it's a fair outcome of some kind. Okay, so now that we've talked about a little bit about ADA and what it covers, who it applies to, let's talk about how you actually ask for the accommodation. Okay, now by law, technically, if the disability is obvious, you don't even need to ask, all right? But to avoid the issue of whether you actually need accommodation or you ask for it, it's best to just ask for it, okay? Similarly, it doesn't require that the request be in writing. However, just to make sure that there's a paper trail, like Kathy was mentioning earlier, it may be helpful to put that request in writing, whether it's in the email or a letter to your supervisor or your HR department, just to make sure that there's no confusion as to whether or not you've made the request, okay? Now, as to who you made the request to, common examples of people you can reach out to are, of course, your supervisor and your HR department if your employer has one. But also consider looking at your employee handbook if your employer provided you with one, since that handbook may have a guidance for you as to who you need to specifically talk to request this accommodation. They might have someone specifically designated for that role, okay? I've got here a couple examples here for you to look at as examples of whether or not a reasonable accommodation has been made, okay? For the first example here, an employee tells their supervisor, I'm having trouble getting to work at my scheduled starting time because of medical treatment I'm undergoing, okay? That is enough to be considered a reasonable accommodation request, okay? A couple of things to note here. The employee never mentioned the word reasonable accommodation. The person also did mention that what was the medical condition that made them need to miss or be late for work because of the medical treatment. As Kathy mentioned earlier, whether or not you want to tell your employer that you have cancer or has a cancer diagnosis is a very personal decision for you, and you are not required to disclose that information, but you do need to at least let the employer know that you have a medical need and what is the accommodation that you're looking for, okay? The other example here, and this is an example where the accommodation should be obvious, is that a new employee who uses the wheelchair informs the employer that her wheelchair cannot fit under the desk in her office. Okay, so again, the words reasonable accommodation never got mentioned. The employee didn't necessarily specifically ask that her desk be raised up or be changed, but because of this situation and how obvious her disability is, this is enough for there to be a reasonable accommodation request, okay? All right, so let's see here. We're now going to jump over and actually spend the rest of our time talk about cash benefits, right? How to make sure that you have the financial assistance that you need to keep your bills going while if you do decide that you need to take some time away from work to focus on your health and your treatment, okay? So short-term and long-term disability are essentially disability insurance policies that will pay out cash benefits under the policy if you, the person who is insured, becomes disabled, okay? The most obvious difference between the two is how long they will last. One is a shorter term and the other one is a longer term. Short-term disability is sometimes abbreviated as STD, and long-term disability is similarly sometimes abbreviated as LTD. These are just abbreviations to be mindful of in case you're looking for the information and they use the abbreviation instead of the entire written out term, okay? Both of these benefit policies will pay you a percentage of your salary, generally between 60 to 80% of your salary, okay? The key thing to note here is that the benefits under these policies are very, very specific to the policy. So while we'll cover some general norms, when it comes to these policies during this presentation, it's always best to look at your actual policy and make sure that you understand what the terms and conditions are for your specific policy, okay? So how do you even find out whether or not you actually have this benefit through your employer? To answer this question, you can contact your human resources or HR department. You can ask your supervisor. You can check out the employee handbook if you have one, or you can even check your pay stub, okay? And we'll look at that in a minute. But I will note here that short-term and long-term disability benefits don't necessarily have to be through your employer if your employer does not offer these benefits to you as part of your employment package, okay? Both can be purchased individually on your own. However, I will note that long-term disability tends to be the one that people purchase individually, since short-term disability benefits tend to be more expensive, and it's more commonly provided through your employer, okay? I'll also note here that it's important to be mindful of any changes in the insurance company that issue your employer's short-term disability policy. Sometimes when employers switch insurance companies, you will only receive the benefits under the policy if you sign up for it. So there may be some actions that you have to take on your part before you are actually covered, okay? So be mindful of those emails that you may get from your HR department. Okay, so let's look at an actual pay stub here. And this is just an example that I pulled off the web. Now, as you can see from this pay stub, there are short-term and long-term disability benefits that this person is receiving and has through employment. And there are some payments or deductions that's coming out of their paycheck to cover this expense, right? In addition to that, there are payments also made by the employer who's also covering part of the premium for this policy, okay? Now, your paycheck may not look like this because this is just one example. So if you are unsure if you have these benefits and you don't see it on your pay stub, I do encourage you to reach out to your HR department or your supervisor to verify, okay? And know for sure that these are not things available to you before you write it off as something not available, okay? As to how disability is defined under these policies, it can vary. The two common examples I have listed here is one is called an own occupation definition of disability, meaning that you're only disabled if you can't work in your current occupation, right? The other one that has a bit of a higher standard is what's called an any occupation definition of disability, where you're only disabled if there are absolutely no occupations out there that you can do because of your medical condition, okay? Now, a couple of things to quickly go over since we're running low on time here. There are some differences, as I mentioned, between short-term and long-term disability benefits under these policies. And just to give you a sense of the big difference as far as timing-wise, short-term disability benefits usually pay out benefits between 3 months to half a year up to 1 year at most, okay? Whereas long-term disability benefits can be for multiple years, even for your lifetime, depending on how good the policy is, all right? The other thing to also note here is that there may be a waiting period, or what they call an elimination period, that you have to go through before the benefits are actually triggered. You actually get your benefit payments. Okay. All right. Now we're going to transition and actually briefly cover state benefits that may be available to you if you are disabled, okay? With the one here being state disability assistance that's provided through the Michigan Department of Health and Human Services. The key thing to note here is that it is a welfare program. So there will be income and asset limits that you have to meet or stay below in order to be eligible for the benefit. State disability assistance, unfortunately, isn't very much. It's only $200 a month, but it is a benefit that is available to you, a cash benefit that can help cover some costs that you may not be able to cover through other benefit programs, okay? The last one I'll quickly touch on here is, of course, Social Security benefits, which is a common benefit program that a lot of people actually apply for if they are disabled. The two main ones are Social Security disability insurance and the other one being supplemental security income, all right? The thing to highlight here is that the state disability, the Social Security disability insurance benefit is an entitlement program that you pay into through your FICA taxes that are deducted out of your paychecks, okay? Whereas SSI benefits is a welfare program, and much like SGA, does come with income and asset limits, okay? Just to give you a sense of how this all works timeline-wise between all the benefits programs that might be available here, here is what that can look like, all right? So what you can see here is that as soon as you have some type of a medical emergency, you can take sick as well as vacation time, just so that you can continue the income that you need. And then from there, you can go into short-term disability and then long-term disability as you need it. And of course, Social Security benefits can be something you can tap into, as well as health insurance through that, so that you can have both financial coverage, so you can pay your bills, as well as medical coverage. All right. So I know we're a few minutes over, but now we can certainly take some questions if anyone has any questions.
Wonderful. Thank you so much. I did not see any in the chat, but does anybody want to come off of mute and ask any questions? I have some that I can begin with, but please go ahead.
All right. So great job covering about accommodations and leave. But what steps does someone take when the employer either denies your leave or denies reasonable accommodations?
That's a great question. Sometimes there may be a process that you have to go through internally through your employer first, because they can give you the opportunity to challenge that if the initial decision you feel is incorrect. After that, you can certainly also file a complaint with the civil rights agency that's relevant. So for the state law, you're looking at the Michigan Department of Civil Rights if you're trying to get accommodation through Michigan law. Under federal law, if you're looking for accommodation under the ADA, you will probably need to reach out to the EEOC and file a complaint there. Now, there are sometimes, if you go further down and things don't get resolved, there will be also opportunities to file a lawsuit against the employer in federal or state court.
Thank you.
Any other questions from the audience?
So I have a question off of that. So is there a statute of limitations if an employer fired a patient, and can they go back years to file those complaints or get a lawyer to say that they were fired wrongfully?
That's another great question. So I don't know whether or not there is a statute of limitations when the person was terminated because they couldn't get a disability accommodation. I will say that there is definitely a time limit when it comes to any sort of discrimination related wrongful termination cases. And the time frame is pretty short. I believe it's less than a year, probably closer to 6 months. I'll need to double check that. But the thing with these sort of situations is that when these issues come up, it's always better to address them sooner rather than later.
Right.
Because if you wait years and years, then memories fade. Evidence that you need to support your case may be gone. So these are definitely situations that you want to address more urgently than waiting until later.
Right, right. And at the time, while they're going through treatment, they don't want to go down that road of getting a lawyer and doing that fight. They have too much going on. They're
Right.
trying to stay in contact with their navigators and social workers and at the cancer center. They don't want that fight. So thank you
Right.
for that. Such great information. Thank you so much. This
Very
has been
welcome.
wonderful.
So
so-
one thing I'd like to add, if that's all right, is I think what's really important is one of the things that we always ask our clients when they feel like maybe they were wrongfully terminated or something happened at work that they were not pleased with is, what do they hope to achieve from it? Because sometimes employees or clients will say, I just want to be able to go back there, or I just want a fabulous reference from them because I was such a good employee there, or I want to see them sued. But the important thing is to make sure that we understand what somebody's hoping to achieve, because sometimes what they want to achieve can be relatively simple and doesn't even really require any like legal intervention. And sometimes it can be quite complicated and maybe not even a solution under the law. So I always try to have a conversation with the client to say, so what would look like a great outcome for you?
Yeah, thanks, Kathy. That's a great point. Two things. Ali posted a link to an evaluation for this session, and we are sweetening the pot. There is a raffle for a $50 Amazon gift card for people who complete the evaluation, so please do that. And we have one last question from the chat that I'm going to slip in real quick before we wrap up. How do you apply for state assistance benefits?
Sure. Yeah, I can answer that. So to apply for state disability assistance, you do it the same way as you would any of the other state benefit programs like Medicaid and food assistance. You just reach out to your local MDHHS office, or if you have a MyBridges account, you can always go to your MyBridges account and apply for it there. A quick note I'll make about that is that as a condition of getting state disability assistance, you will have to file a claim with Social Security for Social Security benefits as well. And if you're ultimately successful in your Social Security case, the state will expect you to use some of your Social Security benefits to pay them back for the $200 that they pay you in the meantime. So it can be viewed as somewhat as a loan program or a cash advance program for that reason.
Wonderful. Thank you so much. It's now 3:31, so we're going to go ahead and tie it up and let everybody go on with their evening. Thanks so much for coming. Please go ahead and click that link to the evaluation. And Kathy and Min, thank you so much for sharing all of your wisdom and expertise with us.
Very welcome. Thank you for having us.
Thank you. Take care.
Thank you.